Let's welcome a man who is deeply connected to this issue. Jeremy Butler is the Chief Executive Officer of Iraq and Afghanistan Veterans of America. Thank you so much for being with us, Jeremy. Jeremy, we mentioned that statistic, and according to the Department of Veteran Affairs, an average 20 veterans die each day by suicide. I mean, those statistics are horrifying. Help us understand this problem.
No, they are horrifying. It's incredibly tragic. And each year, my organization, Iraq and Afghanistan Veterans of America, we conduct a survey of our membership. And this year we had over 4,600 respondents. And it was overwhelming that our members feel that tackling this issue of veteran and military suicide is the #1 priority for our membership. It's long overdue. The numbers of daily suicides have dropped just a little bit, but with the amount of resources that the government and the country has been putting towards the problem, it just hasn't been solved yet. And to answer your questions, we're not really sure why. It's such a complex issue. There's no simple answer. What it's really going to take is a collaborative effort where we combine a lot of different solutions to get at the different reasons why various people are dying by suicide.
I understand that it's a very complex issue, a terrible issue. But in your opinion, is there a manner that needs to be done? Is there a manner to address this or prevent this that hasn't been done?
Well, I think things have been tried. There just needs to be more of it. We need to increase discussions about it. So the fact that you guys are talking about it right now is a great first step. We need to increase the discussions around suicide. We need to normalize the discussions around mental health and suicide. We need to make sure that people know that it's okay to talk about it. In fact, it's healthy to talk about it. So we need to do that. We need to improve public understanding of suicide and the crisis of suicide. We need to increase the American public's engagement in this issue. So talking about it, sharing solutions, sharing resources is very important. And then we need to expand access to care. We need to make it easier for not just military members, but veterans and the general public to get access to immediate care when they're having suicidal ideations.
Well, what kind of care could help address this? And what can this executive order signed by the president accomplish? He's created this high-level task force. What do you expect this task force to do?
Well, the task force has a year, 365 days to develop a roadmap to begin to tackle this problem. And one of the areas that the president's executive order laid out that they want to have happen is also to generate a grant program so that we can begin to fund organizations and institutions that provide suicide preventative treatments and response or opportunities. So that's the first quick step, is to, again, make it easy for people when they're having a crisis, if you know of someone that's having a crisis, to be able to reach out to them. So the fact that they're putting some money towards this, say we want to give grants to organizations that are starting to help, this is a great first, because our number 20 suicides a day, 14 of those veterans are outside of the care of the VA, so they're not connected to the VA. So simply trying to tackle this through the VA isn't going to get at the root of the problem.
Jeremy Butler, thank you so much for your time and for tackling this very important issue. We appreciate it.
Thank you.